Katie and her mom here, and I wanted to ask you, what brought you to my practice?
We actually were referred by our regular family physician because Katie had TMJ to the point where she could not even function. She had headaches every day. She was in the school nurse's office all the time. She was just miserable. She didn't want to go to school. She would come home and lay on the couch with just debilitating headaches. And the doctor said, either take her for someone for the TMJ or send her to a neurologist. But if it was my child, I would go to see a doctor who specializes in TMJ. And I said, do you have anyone in mind? And he said, there's one person who I know in Doylestown. I heard about her. I don't know her personally. Let me do a little research and get back to you. And he gave me your name.
Perfect. Okay. And Katie, you were like a young whippersnapper when you first came here, so it's been a long time. And your experience was, we got you out of pain how quickly? Do you remember?
It was pretty instant. Once I came here, I felt better almost instantaneously.
Okay. And we put you through a lot. Do you want to tell what we put you through?
A lot of, oh gosh, we did a lot of what are they called, like a lot of.
We made an appliance to.
Yeah, so many appliances.
Yeah.
Different appliances. We had palate expanders, tensing.
So we did ortho,
Yeah.
and we and we expanded we made we grew your mouth.
Yeah, definitely.
Yes, but one of the things that was really cool was with your posture.
Yeah, it's
So tell us
definitely a
about that.
change. Looking at pictures from before, I'm completely hunched over, and now it's like almost natural to stand straight up. It's so nice.
Wow, that was powerful. Okay, so now that you are past ortho by, God, many months, how do you feel?
So much better.
Okay,
Yeah.
you're good. And I'm curious, when she was in pain, I remember you telling me that she was like, would lay on the sofa and not be part of the family stuff.
Yeah, my husband could not believe that a kid who was 12 or 13 years old could have such bad headaches. He couldn't fathom it. And nothing worked. No Advil, no Tylenol. She used so much Advil. That's how we ended up at the doctor. She used so much Advil that she gave herself a stomach ulcer. So, it was just a question of what do we do? And we took her to the pediatrician initially, and the pediatrician had a doctor in training with her and said, can I have her feel Katie's jaw when it does that pop? And so that's what she did, pop, 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 that horrible crack. And she said, wow, that sounds really bad. And I said, well, what do we do? Oh, we don't treat that. Okay, so I now went to the dentist, and the dentist said, oh, we don't treat that here. That's ortho. We went to the orthodontist, and the orthodontist said, if someone tells you they can cure it, don't believe them. If someone tells you that braces will make it better, don't believe them. Run from their practice. And so he gave her a soft night guard, and we used that for about 6 months, maybe. And eventually, she was in worse pain than when she had started without the soft night guard. And he said, why don't we put her in some braces and see if that helps? And I said, thank you, goodbye.
Wow.
And so that's when we switched her to our family doctor, and he finally had the brains to send us to you.
Oh, well, thank you so much for this. This is really great. And it seems like Henry's really enjoying being on your lap there. I'm having a hard time getting it all on one screen. There you go. But thank you so much.